the College of Health Sciences, Obafemi Awolowo University, Ile-Ife. We consider this a privilege and an honor. And when the committee visited me in my office recently, I had committed to being of support to the committee and indeed the association as a whole. And I still stand by this. Again, let me also place on record the commendable strides that this committee is making in the public health space in our nation, not just among students, but they are doing things that will impact not only themselves, but the community, Nigerian community as a whole. And for this, I say kudos to you all. Keep the flag flying, keep soaring, and I wish you successful deliberations. I join you in saying a very big thank you to all the distinguished speakers who have joined since yesterday, who will continue to be part of the event today. Without doubt, we have a lot to learn from the wealth of experience of these forebears. And I can only say thank you on behalf of our student body. And once more, wish you all successful deliberations this morning. Thank you so much for the opportunity.
All right, thank you very much, sir. We are very grateful, sir. You are indeed a father, and we are happy to have you in our midst this afternoon, just like you rightly committed when we visited you. Thank you very much, sir. We are very grateful, sir. Right about now, we'll be moving on to our first speaker, who has joined us long before now, Honorable Samuel Adijari, Vice Chairman, House of Reps Committee on Health. And before we listen to our father speak, we'll be taking his very short citation to be read by Ms. Anyabule Temiloluwa Rachel.
Okay. Good afternoon. I'll be taking citation of the citation of Dr. Adijari. Okay, Dr. Adijari is a professional and committed grassroots politician who continually strives for excellence and attained professional distinction as a medical practitioner. He has a passion to I'll take the citation again. Dr. Adejare is a professional and committed grassroots politician who continually strives for excellence and attained professional distinction as a medical practitioner. He has a passion to always relieve the pains of others, putting smiles on their faces, especially his patients. He is committed to the dutiful and qualitative representation of his people and party at all levels, at all times, and in any position he attains. He remains resolute in any commitment to the pursuit of excellence while remaining focused, proactive, and prudent in a way that ensures maximum value for his people, party, and posterity. He is an ardent team player who understands that no society can develop with people working in silos, but in appreciation of the dynamic roles of association in providing the needed platform for attainment of a collective goal. Welcome, Dr. Adijare.
You're welcome, sir. Honorable Dr. Samuel Adejare. You can unmute yourself now.
Hello.
Hello, sir. We can hear you, sir.
Oh, I wasn't hearing you towards the end of your presentation.
Oh, sorry, sir.
Good afternoon, everybody.
Good afternoon, sir.
The provost, good afternoon, sir. All other speakers of today and participants.
Thank you.
I'm so glad to be on this program. This your leadership summit. I've been looking forward to it, and has been postponed severally. One thing or the other. All the same, I'm so glad to be here. I'm sorry my voice is cracking. I have cold. Please, we'll manage and pull through it. I cannot but think about when I was in medical school. Try and look at those days and what you people are doing now. And I want to tell you, you are really doing better than us. And you are doing very well. We never had this kind of Zoom meeting place in virtual like you're having now. We don't have. Even what we had then, we're not doing things like this. No. And then when your new elected president of NiMSA came, and even his predecessor, was so happy to receive them. And I want to say that you people are trying so well. And I just continue to pray for all of you. Where we got into, you go more than that, in the mighty name of Jesus. I think you said I should talk about repositioning the public health sector in Nigeria, the role of medical students in effective policy activities and legislative reforms. Why repositioning? That was the first question that came to my mind. Why repositioning? The answer is so simple. It's because we want to make what we have better. We want to make what we have a better system. Because we all know that for now, what we have as our public health sector is not where we want it to be. We are not doing too badly, but by the grace of God, we will get over these these problems for ourselves. But one thing I want to emphasize before I go ahead is that during the COVID pandemic, we were able to do lots of things. And what really brought about that was that more money was given to health at that particular point. So it's so obvious that to make our health sector better, to also make universal healthcare available to everybody, we need to give that sector more money. If you look at it very well, the Abuja Accord, where they signed that every country must give 15% of their budget to health sector. It was signed in our capital, Abuja. Up to today, I don't think we are giving that sector. The last one, the 15%. The last one was about 5%. And the maximum that I ever got into was 6 to 7%. Having said that, I will have said, and one of the things I want to say earlier is that, please, I want to implore that as medical students, you are in school to be trained to be a doctor. It gives me a lot of heartache and concern to see that even during graduation, you hear newly graduated doctors telling you they will not practice medicine. I just want to use the opportunity to say that You know, for you to come and be a medical student and want to be a doctor, you must have a passion to want to serve, to want to manage people, to want to treat people. And I don't know what will go wrong in that 5 or 6 years of your training. And immediately you get out of medical school, you are saying you are not going to practice medicine. The doctor-patient ratio in Nigeria is so low. It's about 1 doctor to 2,500 patients. The WHO recommended ratio is 1 to 600, and ours is 1 to 2,500. I'm using this opportunity to say that it's a job that we all have enlisted to do. You cannot now finish your training and say you are no more practicing medicine. Please, we need every hand on board, and God will help all of us in the mighty name of Jesus. Having said all this, I want to quickly go into telling us or defining, looking at the word advocacy. The definition of advocacy, many definitions of advocacy, but it simply means any action that speaks in favor of, recommends, argues for a cause, supports or defends or pleads on behalf of others is advocacy. You argue for a cause, you argue for somebody's interest, you argue or you make presentations for a particular law to be known, to be well established to all of us. All that are advocacy. And it has another definition of it is advocacy refers in a broad sense to efforts to promote in the domain of humanitarian aid, respect for humanitarian principles and law with a view to influencing the relevant political authorities. There are 3 types of advocacy. We have self-advocacy, we have individual advocacy, we have systems advocacy. In the self-advocacy, you are advocating for one person, particularly for yourself. You have an interest and you are telling people, you are making people to know about this interest because you need their support to get what you want. That's self-advocacy. That's individual advocacy, where you or group of you are advocating for a person or 2 people of their interest, of what should be done to them, what should not be done to them. That is individual advocacy. The system one is when you, a group of people, you are advocating for a change in a law, or for a law that has been there and people are not really respecting it, and they are advocating and they are bringing it to knowledge of everybody. That is what we call systems advocacy. There are 5 principles of advocacy. If you want to advocate, for anything, there must be clarity of purpose. You must know what you're advocating for. You must know it inside out. You must be knowledgeable about it to the extent that you'll be able to convince another person. That's number 1. And number 2 is safeguards. The number 3 is confidentiality. You must, if you are advocating for something, there are some things you know about that thing that you might not be able to say outside or to say in the open, but at the same time, you say advocate for it. And there is equality and diversity, empowerment, and putting people at first. After I've looked at this, I now said that, look, the best way to present this to everybody is to take us through the formation of the legislative network for universal coverage, health coverage. There was this network that was established in 2017 at the National Assembly. It consists of all the principal officers of all the health committees of the National Assembly, all the chairmen of health committees of the State Assembly, all the speakers of those state assemblies, the Senate President and the Speaker of the Senate and National Assembly, and the Federal House of Representatives, all the clerks of those committees are both at national and state, and also the Ministry of Health and some of our partners, donor agencies, are all involved. I want to put it to you that for any health system to really do its job or fulfill responsibility to our citizens, to everybody, it cannot function in isolation. It cannot function alone. It has to work with other people. It has to really cooperate with other people. And for it to work, it needs good governance in terms of policy making, fund allocation, oversight, and accountability mechanisms. And if you look at this, policy making, fund allocation, oversight, and accountability mechanism, all those are embedded in the functions of a legislator. If you look at the legislator, we appropriate, make funds available for all these sectors, including health. And since I just told you when I started that, during the pandemic era, we were able to do so many things. Before those COVID came, we had only 2 molecular labs in this country. Now, today, we have about 60-something molecular labs, government-owned, and I see some private-owned ones. That is because we were able to allocate a lot of money, that, to health sector to take care of our preparations for COVID at that time. And if you look at it, you will notice that the legislative arm is the first arm of government, because it plays all these roles I have enumerated earlier on. Their own is to provide policies, and they play key roles in developmental objectives, and also, which also include delivery and access to universal healthcare services. And when this was started, it was started to really take care of, to make sure that we get this issue of universal healthcare coverage in our country, to get it going, and we've become very serious about it. There are a lot of things that happen on the health issues. You begin to wonder that sometimes our colleagues, are they not human beings like us? Don't they fall sick? But you see, before the LNU, that is Legislative Network for Universal Health Coverage, before it was started, they discovered that a lot of us, honorable members, had little or no knowledge about economy, about what the consequences of health and of ill health, and what health really means, and what it means to our economy and even to our country. So they started this LU. When they started, they recognized all these inadequacies And a lot of training were done for the honorable members. A lot of training, a lot of seminars with our donor agents were organized, and they will come together. They will come together and they will put up, beginning of year, they will put up a legislative health agenda so that everybody across board throughout the country will be working together. And if you permit me to now say that if you look properly and closely at the functions of the legislator, like if you take appropriation, for example, if you don't allocate adequate resources to health, there is no way we will get what we want. Our hospitals will keep continuing to be what they are. I can tell you authoritatively, a lot of repairs were done in our teaching hospitals during that COVID era with the emergency funds that were released to them. And things got better. We know that we still need to do more, and we are planning, and we are going to do more. Legislation, you see, all what we are saying, we need legal frameworks. It's required for specific policy. There is no policy we bring out that you don't need legal backing. If you don't do that, anybody out there can go to a court of law and sue government and say what they're doing is not backed by law. Like this universal health coverage, the Health Act, we just, in this even night assembly, we just amended the Health Act to take it into consideration a lot of things. There is funding for emergency treatment by government all over this country. There is funding for it. Eventually, there was even a time in the 8th Assembly, because of this LNU, because of the creation of this LNU, this legislative network for universal health coverage, there was this fund that was created. We call it Basic Primary Health Care Fund. And it's 1% of the Consolidated Revenue Fund. And they've been doing this since 2018. And that was 1%. And because of the amendment we've done on the Health Act, the 1% is now shared to take care of people that cannot afford health care, and a substantial part of it has been allocated to take care of the National Health Insurance scheme. There are a lot of money going to our primary health care directly. It will not go through the state, it goes directly to them. And those monies and funds are being managed by the World Health Committee that oversees all primary health care centers in their own world, all over the 700-something local governments. The legislature is also involved in oversight function. When we allocate these funds, it is in the purview of the legislator to see that these funds are spent effectively and efficiently. The Constitution empowers us to look at how these funds are spent and where they're put into, and what and where they're put into. We are at liberty to go to all these places and check what they've done with those funds. We also have the power to make them accountable for the money we have given them. I am the deputy chairman of the Healthcare Services Committee of the Federal House of Representatives, and quarterly or periodically like that, we call all these ministries and departments and agencies to come and give account of the money we have appropriated to them. A lot, I can tell you that a lot goes into it. And we make sure doing this that a lot is what we appropriated for. And let me tell you, what we are appropriated for is not necessarily idea from us. It has to be tailored against the needs of our people at the grassroots level. So if those money are well expended, effectively done, a lot will be changing. And I assure you a lot are changing. And we still need to do a lot more, but we'll get there. In the mighty name of Jesus. We also do the function of representation. We represent our people. If there are national issues or even local issues, we listen to our people, because personally, I still live within my constituency. There is no time I'm in Lagos, they won't know I'm in Lagos. And they come around to my office, we talk, we listen to one another, we see our common general problems, challenges, even individual challenges, and we try and sit down and resolve them. And resolving them sometimes might propel a representative like me to go on the floor of the house and move motions to solve those kind of problems. This is what a legislator will is what we do. And I am going to this LLU thing to make sure that, to let us see reason why advocacy. You see, I told you about basic healthcare fund. There was even a time about almost 18 billion was given to Ministry of Health, this basic healthcare fund. And this, like I said, has helped us a lot to really make health available to a group of people that had always find it very, very difficult to access health. Because if you look at it very well, a large percentage, about 60-something or 70% of our healthcare system is being done by the private practice aspect of healthcare sector. It's only about 40% or less than that that is done by the public health facilities. Most of the care that is given in our country are done by the private practice sector, including all the traditional people too. So therefore, with these new law that we created, we amended the Health Act to put that basic primary health care fund in it. And that has really helped a lot of people, and it's still helping people. I want to use, and when I first got your topic that was sent to me, said the medical student is supposed to be in school and studying to be a doctor. But it's not all about that. You two have a role to play in this. There is no part of this country that is not represented by the honorable member of the Federal House of Representatives. There is no part of this country that is not represented by a senator of the Federal Republic of Nigeria. Even the senators, there are only 3 per each state. But the House of Reps, like in Lagos, we have 24. And in Kano, we have 24. Those are the 2 states that have the highest number of honorable members. There is nothing that will stop you meeting these honorable members at their different constituencies. Each one of us has a constituency office in our constituencies. There is nothing stopping you as a group to now come up with a policy on your own to say, okay, let all of us in our different homes or different places with our parent society, let's meet the honorable members and advocate for more funding for health. Because at the end of the day, they are the one that will go back to their house and during budget sessions, we allocate all these funds. The moment we start, the more we start to let them understand why there has to be more funding for health, what it will do to the country as a whole, to our economy, to our culture, to our well-being, it's among us. It's something that is very, very critical to all of us. But there are a lot of us out there don't know. And so therefore, I want to say that your role in this is not something that's out of place. You too can advocate for universal health care and visit all these legislators. You can visit the senators too. So there is nothing that even says you cannot visit the governor of the state. You can write to them, write to any one of us, and I'm very pretty sure they will find a time for you out of this busy time. I really want to say that it's been my pleasure to be here and to talk about this issue. I will want to stop here for now and want to listen to people that have asked questions, and I think I'll be here to answer those questions. Thank you so much for listening to me. So,
all right, thank you very much, sir. We are very grateful. That was a very wonderful one, and it was an eye-opening session. Jairus Adetifa is always a very intelligent father, coming from the NiMSA Southwest Convention in 2020. He was a lot we learned, and today we have learned a lot again. Thank you for always opening your doors to we medical students. It's been a pleasure, sir. So,
you're welcome.
for those of us who have questions, please, you could signify by raising your hands, and then you would unmute your mics. Or if you cannot do that, you can also type your questions in the chat box. For those joining live on Facebook, you can type your questions in the Facebook comment section, and we will respond to it as soon as we see it. Our provost appreciates our Darius Honorable for the insightful talk. Thank you very much, sir.
You are welcome.
While we are expecting more questions, thank you very much. You recognize some of our other speakers who are also in the call, on the call with us. Thank you very much. And yes, of course, let's show our appreciation to Jairus Honorable for joining us today. Let's keep the thank you so much. Let's keep the thank you messages. Let's keep them coming. Oh, I can see somebody clapping. Thank you very much, sir. We are very grateful, sir. Thank you very much. Thank you, sir. Like I said, if you have any questions, please use the chat box and also the Zoom, the Facebook comment section. Like, we'll check everything. Can you please type your question in the chat box then, if it looks like this? All right. Thank you so much. I think there are lots of thank you comments in the chat box. We are very grateful, sir. Thank you very much, sir. Thank you. Absence of any questions, sir. Oh, okay. There's a question in the chat box, sir. Question says, oh, the question says, sir, you said that we can come as a group, referring to NiMSA as the group, to demand for funds, right, from the jurisdiction of our local constituency. Is that what you said, sir? I think he demanded to demand for the allocation of more funds, but I'll leave Honorable to answer that.
Thank you, Tim Tayo. Please, I did not say that. I did not say that as a group, you can demand for funds. No, what I'm saying is that you can meet all these honorable members, each one of them, each one of us, wherever you live in Nigeria, you have one honorable member representing you on the floor of the Federal House of Representatives and the Senate. So what I was saying is that we can write to all of them and meet them and explain to them, because you know what more funding to health sector will do to our country, will do to our people. That's what I'm saying. That, and this advocacy thing is an advocacy. You'll be advocating for more funds for health sector if you do that. And that is, you'll be doing a lot of good to all of us if you can do it. Because that honorable member, we appreciate you for coming. We know that this is a member of my constituency coming to me to advocate for more help. We must bring the funding of health sector to the front burner. We must make it a political issue in this next election. All of us combined together, no matter whomever you are in the health sector, all of us must bring it to the front burner and make it a political issue, make it an issue in this next election, so that there will be more funding for this sector, and we'll get out of all these issues we find on our hands. Thank you. Ifedayo.
Yes, sir. Thank you very much, sir.
I think I've answered it.
Yes, sir. Yes, sir. You just did. Thank you very much, sir. In the absence of any other question, I think it's a very big thank you from us all, the leadership of the Nigerian Medical Students Association, and the president, who is not available yet at the moment. Thank you very much, sir. I wouldn't know if any of our other speakers have a word or two for everybody before the end of his session. Oh, our provost has his hands raised. Please kindly unmute your mic, sir.
Yeah, thank you very much, Tayo. And let me also thank Honorable Adetifa once again for his very, very insightful speech. I just also want to join my voice to that of the distinguished Honorable, that advocacy truly works. I've known people who have been involved in such processes, and on the long run, it paid off. However, one thing I must also not fail to add is that the process can also be painstaking. In a country like ours, truly the ease of doing business at whatever level, whether advocacy, whether business with financial returns, whatever, it's so cumbersome, and it involves a lot of rigor. And but it's one thing to start, and it's one thing to get to the end. And I'm happy that Honorable Adetifa has told you now today that even as a student body, there is a lot you can also do, even if it's just taking out health sector funding, or even funding health professions education training. If we just put that in the front burner, constitute ourselves into advocacy groups, and no matter how daunting the task seems, if you persevere and persist in it, and I want to particularly charge this Standing Committee on Public Health, if that will be one of your cardinal objectives in your tenure, please do that. And with somebody like Honorable Adetifa there, who can also be a voice and a door to the House as a whole. So that's what I wanted to add to the discussion. You started on a good note, persevere in it, and I believe that something positive will come out of it. So thank you once again, Honorable. Thank you, NiMSA, for putting this together. God bless. Thank you.
Thank you, sir. Am I permitted to speak?
Yes, sir, definitely, sir.
I want to thank the Provost for that comment. And I want to say that sometimes if you, nothing venture, nothing gain. That's the saying of our people. Like when NiMSA came to me, I don't think it was difficult. I don't think it was difficult for you to talk to me. Maybe because I'm a doctor like all of you. But also, I know that around this time, every politician wants to listen to everybody. So we can achieve a lot by going to them. Thank the Provost very well. If you make that your action, one of your action plan, it will be very, very good. A lot of applaud will come for you from so many angles throughout the world. We need more funding for health. There is nothing that will do that will too much to do. So, and I want to pledge here that I'll always be ready to assist you to do that. In any form you need my assistance. Thank you.
Thank you very much, sir. I think that was very heartwarming. It was very good to hear that. Many thanks to our Provost as well for adding that very important iceberg to the discussion. And that is duly noted, and we will ensure to work on it, even with Honorable Adetifa, who has having pledged that he is always ready to give his assistance, which is what he has always done in time past. Thank you very much, sir. We are very grateful. We hope to keep communications with you, sir. Very quickly now, we'll be moving to the next session, and I'll be handing over the floor to the other moderator to invite the next speaker who would lead us on the next talk.
We'll be having Mr. Gabriel up here now, but before his session, Mr. Damilola Akimbo will be taking his citation. Thank you.
Okay, I'll be taking the citation of Mr. Gabriel, okay? Gabriel is an early career researcher and emerging health journalist, interested in health system strengthening, health communications, thought leaderships, and health advocacy. He has written 30 plus peer-reviewed articles and blogs on All Africa, Nigeria Health Watch, People's Gazette, and HPHR. He is currently a program assistant at Nigeria Health Watch, an alumnus of the British Council Future News Worldwide Program, a program for emerging journalists and 2021 HPHR Journal Fellow, a fellowship organized by the Boston Congress of Public Health for Emerging Thought Leaders. Gabriel is also a 2019 Young Medical Laboratory Scientist Forum Achievement Awardee and 2021 ISN Top 3 Medical Laboratory Scientist Awardee. Gabriel has won grants from the Royal Society of Tropical Medicine and Hygiene to access the care available for people living with leprosy in Nigeria, and also a grant for Knowledge Action Change, UK, to bridge the gap of knowledge and journalism gaps in tobacco harm reduction reporting in Nigeria. He is the founder of MedLab Convo, a community for young medical students and professionals supporting students and young professionals with resources for professional development to strengthen future human resources for healthcare. This is done using e-learning platforms. The organization is also involved in health communication, health advocacy, and health promotion. The organization has 5,000 plus subscribers, followers across Africa, Canada, the USA, Tanzania, Lebanon, on social media platforms, and representatives in Nigeria and Tanzania, which includes 30 universities. About 2,000 plus students and young professionals have benefited from capacity building and mentorship programs. Also, 2,000 plus secondary school Nigerian students have been impacted by the career day programs that will enable them to make informed decisions about their future careers. Gabriel has worked with the Adolescent and Youth Friendly Center, Public Health Department of Osun State Ministry of Health for 5 months in 2018. He later worked and gained relevant experience with other youth-focused organizations. He leveraged these platforms to learn and increase his competency in research writing, health advocacy, project management, and project planning. Gabriel is also a 2019 Millennium Fellow, member of Health Systems Global, and a member of the Royal Society of Tropical Medicine and Hygiene. In 2019, he was also a co-presenter on Ray Power FM, Oshogbo, Osun State, for radio shows focused on improving community participation in the achievement of sustainable development goals in Osun State. In 2020, he was recruited by Pro Health International to work as a surge staff for the Port Health Services of the Federal Ministry of Health as Nnamdi Azikiwe International Airport for 3 months. He was also a virtual intern with the West Africa Academy of Public Health in 2020. Help me to welcome Mr. Gabriel, okay?
Can you hear me? Hello? Can you hear me?
Yes, sir, we can hear you, sir.
Hello? All right, thank you very much for the opportunity. I'm grateful because I have limited time to NiMSA executives. I'm grateful to NiMSA Public Health. It's actually a very good thing to see that young people, even from school, we are building capacity. We can't actually ourselves, please. Let's listen ourselves. I can hear some sound. Okay, so right, so research is actually very important in public health. What really means? Okay, because R&D is very important. The reason why all of us are doing that, the reason why no country in Africa was actually able to like come up with any vaccine was because we really don't have strong R&D. We don't have strong research and development capacity, and that's because you really need evidence to develop innovations. You need evidence to be able to come up with solutions to human problems. Okay, so and I think one of the opportunities we need to start keying into as a body, as NiMSA now, is how to make sure that we have the young concentration groups in some of these big development organizations. Let me give an example. So I think last week or within the last 2 weeks, WHO is supporting some countries to be able to produce their own local vaccines in Africa, like 7 countries, and Nigeria is part of these countries. So these are the opportunities we need to start keying into with our research capacities. So yes, we can't just say, okay, because I'm a student, because I have this volume of work to do, I will just try and finish my modules in school before I start entering in some of these opportunities. A lot, it's just because of the country we are, right? So as a student, there are some of these gaps that we can feel, you know, even as a student, even as a body. So as NiMSA now, we need to start looking at how to solve some of these problems so that by the time we are professionals, by the time we are entering the field, probably you are doing or you are an officer somewhere, you already have capacity. It's not when you are now faced with a lot of calls, a lot of some of these things, you're not putting in some of these basic skills. So we have to look at how we can use our research tools to research capacity, research skills, data collection skills, research writing skills, how to develop some of these questionnaires, how to develop focus group discussions, how to go to field work with some of our community advocacy that we do, because I know NiMSA, we do some of these medical outreaches. how can we put some of these data together to increase access to healthcare in Nigeria? Because the whole goal of public health is to make sure that health is delivered to everyone. Nobody should be left behind. That's the main aim of public health. And I think with the way the world is going now, right? We are just coming out of the pandemic. We are still, we are still have COVID-19 with us. But even at that, we now have a potential World War III coming. So I think it's beginning to, we are seeing now how important it is to actually protect lives. When lives are not protected, everything will stop, right? Because, for example, in Ukraine, you can go to work now. A lot of students are not able to go to school again. So I think it's becoming more important, even from 2019 pandemic. Okay, when COVID was first detected, then to the whole pandemic lockdown, economic meltdown, a whole lot of things, right? And then now again, Ukraine and Russia again, NATO, everything. So I think we are seeing now that everything we are doing, right? Everything we are doing, either in clinicals, either in research, either in development space, we are going to be in the NGO, we are going to be in any space, right? The goal of everything is how am I contributing to saving lives? Am I contributing to preventing infectious diseases? Am I contributing to treatment? So that if you don't have some of these insights now, you just get to probably you're doing your job, you're doing your residency, and then that's all. Okay. But there are data that we can use from some of these hospitals, the capacities we can build within our bodies to be able to support these old big public health is wide. And that's why you can see people that are not even healthcare professionals are in public health. A statistician, someone that is in probably studied statistics, can come into public health and still find a way to work maybe in the sector, maybe healthcare financing, doing analysis. So everybody can come. It's about life, okay? It's about life, and we all need to come together. So I like what Honorable Adetifa said about I think basic healthcare provision fund, because I remember I work in Nigerian Airports, and one of the things we do is advocacy. I remember when we started advocacy for basic healthcare provision fund, it's fund from the RTSL, fund from Resource to Save Lives, and then Global Health Advocacy Incubator, JTI. I remember then when we started, because there's something called JEE score. JEE score is a joint evaluation that is actually done to know how a country can prevent infectious disease and then manage it and then prevent future pandemics, right? So the score that Nigeria had was very low, and this is because before COVID-19, Ebola came, we were able to manage it. Lagos State was able to at least contain it to a good extent. And I think what we need to know now is that if we as students are not developing ourselves in terms of research, evidence building, evidence for advocacy, building evidence for everything we're doing, we will still have the same problems that we have now. We still have the same problem that we have within time we are in school. So we are coming out of school facing the same problem. So we have to start building capacity. And then I remember then when this provision fund that was being advocated, advocacy, okay, 5% or maybe the national budget going for healthcare, a whole lot of things, trying to build, bring stakeholders to engage stakeholders, trying to bring people together, maybe people that are into budgeting, a whole lot of things we brought together. That was when I got to see that the whole thing we call healthcare is for everyone. It's actually for everyone, not just people that are professionals. Students need to really build capacity. And you may be thinking, okay, what if I don't even want to go into the development space? I want to be in this particular space. I even want to go out of healthcare. What research will give to us, even apart from some of these things I've mentioned, is that as we're going into graduate school, we are going into anywhere you want to be, you want to go, if you want to become a research assistant, you want to work with an organization, start developing concept notes, developing literature reviews, developing reports, report writing, RFPs, a whole lot of things come with the knowledge of research. Research is ability to find evidence. Research is ability to deep into data that are hidden. Research is ability to analyze data that are stored somewhere. The big data analytics and data science world now is becoming bigger. Every organization, is trying to bring in more data people into their space. So I think these are opportunities that we can even fill into. Even as students can get data analysis job, just to be able to conceptualize research, ability to write research, ability to write reports, so that things become very for us, not just for us as individuals, because I mean, you get paid for some of these things, you do them on your own. I mean, you get freelance jobs, you get a whole lot of things done, right? But you are also contributing to the society. You are contributing to the whole big public health space. And I think another thing that I would like to add is the fact that evidence helps us to bridge the gap of misinformation. Okay, so one of the things that COVID-19 happened during COVID-19 was that there's a whole lot of myths. I mean, the problem that we faced during COVID-19 pandemic was not just even the issue of transmission of infectious disease of COVID-19 among people infecting each other, people not using face masks. Most of the problem we had, a whole lot of problem we have was in the area of infodemics. WHO director called it infodemics in one of his speech then. Because on WhatsApp alone, before you know, people are pushing out data that they don't even know where the data. People just look at the money and start saying, okay, COVID-19, you drink ginger, you use this, that. And a whole lot of people went into, a lot of just using whatever they can use, to just push a lot of agenda, disinformation everywhere. So one thing we can do as students is that we can use our channel, okay, because with the way student leadership is, or organizations are in various universities. So one way we can support public health, one way we can support the whole healthcare space of providing healthcare to everyone, is by advocating for some of these things. Debunk misinformation, please. Use your channels to debunk misinformation, your channels, your various medium to debunk misinformation, because you don't know who you are helping. A lot of people died for using just anything during COVID-19 pandemic when everything was very high.
For me, so the one go give me, I go there because of okay there.
We really need to start looking at not just being okay, because for example, if I want to tell someone to get mask now, I don't want to keep wearing mask now, or maybe someone to and get vaccinated. I need to come up with evidence, right? You can't just come and say, okay, COVID-19 is this, COVID-19 is that, start wearing your mask. You must be able to debunk it in a human-centered way, whereby you are able to, because the way you communicate to someone that is maybe in Europe, or to combat misinformation in that space, is different from the way you do it here. So we need to start looking at evidence, looking at how to develop some of this framework, so that whenever there is a need, okay, let me give you another example. You believe with me now that a lot of people don't even know the benefits of health insurance in this country. A whole lot of people. I know as students, if we don't start working to support things like that, because healthcare insurance can solve a lot of our problems. If everybody is insured in this country, it will solve a whole lot of our problems. A lot of people are having issues, with terminal diseases, with even just minor diseases, and they're not able to solve these problems because they don't have funds. And a lot of people are in familial poverty. A lot of people are poor just because of one cancer to their family. Maybe cancer in maybe one of the children, or maybe the father has prostate cancer, and then that's the end. That family, all the money they have is just can't even do that. If you have good health insurance, and then for example, that basic healthcare provision fund is solving a lot of problems in this country now. So this fund is placed directly to primary healthcare centers. Imagine if a particular fund is put into the hand of public primary healthcare centers, which is actually, primary healthcare center is actually what connects the Nigerians to healthcare in Nigeria. A lot of people can't even afford tertiary healthcare in this country. But if the primary healthcare is very strong, it solves a lot of problems. And then basic healthcare provision fund is putting money in the hand of the primary healthcare center. So this advocacy and evidence that are built around and the engagement solve that problem, right? So we need to start looking at how to solve all the problems, bring solutions to all the problems we have. Digital solutions can help too. A lot of telemedicine projects, a lot of telemedicine projects can help to solve a whole lot of our problems. So we have to start looking at solving the whole problems we have. The time is very short. I'll be running off now. With evidence, you can't just come out there and apply for maybe. For example, NiMSA can get grants to do some of these things, and you can apply for grants if you don't have evidence. You're able to build your concept, and make people to believe what you're saying is true. So I know I'm putting a lot of things together because I have just 10 minutes. I'm very sorry I was not able to structure everything I have to put together because I have to just communicate everything I want to go. So thank you very much for having me. I think I've been able to tackle some of the questions that I was able to address during the preparation of these webinars. So I'm very grateful. As students, I think we just have to know how much of research do I need for my future? How much of research do I need to solve the problems I want to solve in the world? So you know how much of effort you have to put to research, even in school. Maybe you start serving as research assistant in school, or maybe you just start attending research webinars just to train yourself and get some of these research writing skills, or maybe you just then a research group and start writing research. A lot of students are doing that. So I think we need to start building ourselves, building capacity so that we can solve problems in the future. Thank you very much. I think that's all for me now. Thank you very much. I'm grateful. So any questions?
Thank you very much, Mr. Gabriel. Indeed, an insightful one. Right now, our time is fast spent. If you have a question for the speaker, you can drop it in the chat box. We still have the DG coming up later. The questions will be answered together later on. We don't have much time now, but you can drop your questions in the chat box and they will be attended to later. Thank you very much, Mr. Gabriel. Okay. So right now we'll be moving to the next speaker. That's Mr. Adewumi Akimbola. I call on Mr. Damilola Akimbo to read the citation.
The citation of Mr. Akimbola Adewumi goes thus. Adewumi is a medical doctor in training with over 4 years of experience in volunteering and conducting social impact activities. He's the founder and team lead of Health Drive Nigeria, an initiative tasked with the responsibility of tackling the menace of infectious diseases in Nigeria. In 2019, he was awarded an ambassador of Institute of Economics and Peace, where he serves to broker peace in Africa and carry out his responsibility to advocate for peace in Africa. In 2020, he was recognized by ex-President Bill Clinton through the Clinton Global Initiative University for his works in combating the menace of hepatitis in Nigeria. He was selected as one of the top 25 change makers out of 700 nominees from 24 African countries to receive the Africa 25 Under 25 Awards in health category for his works. He was selected as one of the top 5 change makers in Nigeria to receive the Nigeria Young Change Makers Award. He was also selected as one of the 30 recipients of AfroSafe 20 Awards. He won the Community Hero category for his work in helping 36,000 indigenous families to gain access to food palliatives through LHGSF program by volunteering with the Federal Ministry of Humanitarian Affairs, risking his life on the peak of the pandemic. He was one of the 123 men selected to join the Cave Adulam Fellowship conducted by Kola Oyaneyi in 2020. In 2021, he was selected as one of the top founders in Nigeria to partake in the ENIA Founders Program, selected as one of the top 30 founders by Africa FinTech Foundry, sponsored by Access Bank, and selected as one of the few founders to participate in the DMZ Black Innovative Bootcamp conducted by Ryerson University. He was recently announced as one of the finalists for the Nigerian Citizenship Awards by iTech Actions, and was recently selected as the recipient of Diana Award, usually regarded as the most prestigious accolade a young person can receive in humanitarian and social works, in the remembrance of Princess Diana for the recognition of his works in the health space. He is a 2021 nominee of the prestigious Telbach SNF Eliasson Prize Ascend Emerging Leader, worth $25,000. He's one of the 3 finalists in the healthcare category of the Leadership Roundtable Summit Excellence Awards by Global Leadership Institute, and most recently received the 2021 Ideal Medical Student Award by Lagos State University Medical Students Association as a testament to championing several high-profile activities across several spaces. Welcome, Mr. Adewumi.
Hi, guys. Thank you so much. A big thank you to the executive team of the NiMSA Standing Committee on Public Health for this invite, and it's a very huge opportunity, and I do not take it. Okay, so time, we have limited time, so I will just quickly run through this slide that I presented, and I hope. Am I quite audible?
Yes, you are.
Okay. Thank you very much. Okay, so looking through some questions now. What is the current situation of public to make things better, and can we actually make things? I want us to go back a bit into the history of public health in Nigeria, and then we'd find out that in the 19th century, there was no formalized healthcare system in the country, and so different communities usually came up with their own kind of healthcare system, and it was deeply rooted in their cultural and religious background. For example, the Yorubas had the Adaunse, the Babalawos, and the Elewe Omo, and we Yorubas are essentially from their cultural background. So every of their belief systems, every of the activities were actually around. Had the Wombai, the Nubes people had the Gozan, and the Igbos had the Dibia. And towards the same 19th century, then we began to have influx of the where we had Pogba, who was the colonial governor and medical director then. And then this man essentially helped to increase Lagos State's sanitation. And then a board was set up to help prevent and treat malaria then. And so majorly, I want us to explore some of the life activities of three giant public health professionals in Nigeria. So the first on my list is Dr. Isaac Oluwole. So this man was usually referred to as the father of public health in Nigeria, and was appointed as the first African assistant medical officer of health in 1925 in Lagos State. And then he started school health services in Lagos and Ibadan in 1929. He was very, very instrumental in the control of smallpox, rabies, and plague. And he opened the first old people's home in Lagos State in 1929. A very, very fantastic man. He was a visionary, and he majorly started the grassroots public health activities in Lagos State then. The next person would be Professor Oladile Ajose. So he was the first Nigerian professor and one of the foremost professors in Africa. He is the first vice chancellor of the Obafemi Awolowo University, and he was one of the earliest proponents of primary health care in Nigeria. So one of his things, I think somebody needs to be muted. Abi? So, okay, so sorry. And one of his major contributions was in the eradication of schistosomiasis in Ilora town of Oyo State. And then the last professional that I'll be looking at is the Oloye Samuel Manua. So he was a pioneering Nigerian surgeon general. He graduated from the University of Edinburgh, was the first Nigerian to pass the FRCS exams. And more importantly, he contributed immensely to the establishment of UCH of University College Hospital in Ibadan, and then he worked for the improvement of basic medical services in the rural areas. And so, exploring the shortcomings of public health in Nigeria specifically, we find out that there is gross inaccessibility to healthcare services in Nigeria, which is likely attributed to the fact that we have limited doctors to the number of patients in Nigeria. For example, in 2019, the World Health Organization said that the doctor-to-patient ratio was 1 to 2,500. In 2020, yes, they said that okay, it had increased to 1 to 5,000 patients, and then in 2021, as at February 14, 2021, it had increased to 1 doctor to 8,000 patients. So, which automatically means that one doctor is attending or would be attending to 8,000 patients. Now, if there is no negative implication of this, one thing that we're very sure of is decreased productivity on the part of the doctors, decreased productivity on the part of the patients, and more importantly, the physician burnout syndrome. Very, very important. So you find out that doctors, and so it's negatively impacts on the public health space in Nigeria. And then also in 2019, the World Health Organization said that only 43.2% of the Nigerian population had access to healthcare services. And so you can just imagine that if less than half of the Nigerian population do not have access, so if more than half of the Nigerian population do not have access to healthcare services, then we are just on an impending doom. Because if there is a pandemic breaks out in Nigeria specifically, I mean, it will be very, very disastrous and catastrophic. And so this just points to the fact that there's a lot of work to be done. Now, aside from inaccessibility, there is also the affordability of healthcare, which is characterized, or which I would say is the leading cause of even the inaccessibility to healthcare services. So aside from the absence of major infrastructural facilities in different parts of Nigeria, because we find out that some states do not have access to MRI machines, CT scans. In fact, some states just have one, some states do not even have. And then a whole lot of other facilities that are supposed to be in place to help access to healthcare. And so aside from those factors, affordability of healthcare, even when the facilities are present, is also a very major issue. And so you find out that social and financial risk protection, according to social protection, for poor and vulnerable populations is a major development and policy issue across the world, not just Nigeria. But I mean, we know that Nigeria itself, is a very, very major player even in this problem. And so there are different definitions for social protection. And then in the context of health, I would say that social protection is defined as the programs and measures that are aimed at removing financial barriers, preventing access to healthcare services, and protecting poor and vulnerable populations from the impoverishing effects of medical expenditures. So healthcare access, healthcare expenses are one of the major causes why people still remain poor. I mean, I was telling a patient some days ago that the difference between an averagely rich man in Nigeria and the poor man is just one health condition. So I was saying that if a rich person should fall sick, for example, a rich person should develop a lymphoma or a very major cancer, the rich person is just one step away from becoming poor, because I mean, the rich person would expend his life, his life savings, and then you find out that there's really no much difference between the rich person and the poor. Talk less of if somebody in a low income receiving community is falls sick and then get admitted to hospital. I mean, it's just going to be poverty upon poverty, and it's very, very, very sad and very, very sad. Because when we come across patients that cannot afford healthcare, it's an emotionally taxing sport, and then it's not something that even doctors should go to, because I mean, it messes with the mind, it messes with the mental health of the doctor, the mental health of patients, and then everyone's mental health just becomes at stake, because I mean, there's lack of proper investment funding in the healthcare, and people have to pay out of pocket for these expenses. And then another major shortcoming, which I would say would be the last I'll be speaking about, is a lack of identification of late identification of epidemics, pandemics, and public health emergencies of international concerns. Luckily, we've not had a lot of pandemics or epidemics erupt from Nigeria. And so if for example, we had the COVID start from Nigeria, I hope we understand that the peculiarities of our healthcare system and what is obtainable in Africa, we cannot control such pandemic. And if we had worse ones like the hemorrhagic fever pandemic, like the Ebola virus, I mean, it would be close to impossible, except if healthcare professionals would begin to grossly relate to their life, which I think would make sense. And so, poor contact tracing, I mean, that one, every one of us should know one or two things about that, because I mean, COVID-19 is a approach. So repositioning through NiMSA. Now, the essential aspect of what I am saying is, I want us to understand how we as NiMSA members can contribute to repositioning the public health sector of Nigeria. And I'll start from the initiation of community-oriented. Now, it's not compulsory that we need to initiate an NGO in quotes before we can carry out community-oriented projects. I mean, a group of 2 or 3 medical students can come together and decide that they want to increase the awareness of diabetes in their community, increase their awareness of hypertension and diabetes in their communities. I mean, they can pick a particular health condition that is very, very prevalent in their community and then begin to carry out advocacy strategies and impacting activities. For example, if I were to focus on hypertension and diabetes and DM, I mean, I would not only just focus on the awareness and the knowledge aspect. I would also help people to ascertain their blood pressure status if they are already hypertensive, pre-hypertensive, or normotensive. And then I would encourage them to visit the hospitals to get expert management, expert evaluation, and then get based on medication. Now that is how the problem that is the most sustainable way the problem can tackle. If we decide to focus on a particular health condition and we restrict ourselves to just advocacy, I mean, it changes little to nothing because these people would have probably heard 1 or 2 things about hypertension from anywhere, and so it does not change because the realities are that they need to understand what the blood pressure is if they are even at risk of hypertension, if they are already hypertensive, and what they can do exactly to not come down with the negative effects of hypertension. And so we're also going to explore partnerships with NGOs and international NGOs. For us at Ifedayo Nigeria, we are a non-profit that focuses on tackling the prevalence of hepatitis in Nigeria. And one of the ways that we do this is, aside from advocacy, we conduct free hepatitis screening and then highly subsidized hepatitis vaccination. Now, hepatitis vaccine is not entirely cheap, but how have we been able to pull this off? We simply identified a few local NGOs, local companies, and one international non-profit organization in Brazil that helps us to get the vaccines at a very, very cheap price. Now, when we get them, it's a standard vaccine, but at a cheaper price because they are the ones that actually subsidize the price of the vaccine. So when we get it, they send it to us and we conduct our impact and activities that we use them for. And so, aside from there is a need for such projects, such NGOs to chase after sustainability, but as medical students, we are actually limited in the scope of what we can do because I mean I cannot give my studies to chase out to start pursuing jobs and all of that, just to ensure that I can sustain the impact activity I am engaged in. So what do you do? Chase after partnership with those NGOs, partnership with companies to ensure that at least whenever we need free kits, they provide them for us, and then they also help us to subsidize the cost of the vaccination. And then volunteering and active participation. This is much more particular for NiMSA members. I mean, if we are actually very keen on repositioning the healthcare sector, the public health sector in Nigeria, every medical student should be engaged in one volunteer activity or the other with medically oriented institutions and projects. It is very important. In fact, apart from the fact that we will be offering our knowledge and skills, we would also be upskilling ourselves with diverse kind of skills. In fact, from when I entered the 200 level in College of Medicine, I immediately noticed that I did not know how to conduct any of the rapid test skills. And so I devoted the entire 200 level to participating in a number of outreaches, and then I got a number of skills, I got a number of knowledge, I got a lot of facts. That would have been how I was able to put together a very fantastic network, and so and a whole lot of other benefits that I have gotten aside from monetary benefits. Because in this kind of activities, monetary gains are not the focus. You understand? And so it should not be the focus for now because we are trying to position the public health sector and we're not trying to essentially put money on it. And so finally, I'm looking at the fundraising support. And I know what some medical students have been doing across different medical student associations in the sense that they've taken it upon themselves to help certain patients on the ward to gain access to funding support from different people. For example, in my medical student association, we just completed the fundraising of about 100,000 naira for a patient that wanted to conduct a test for a diagnostic test for our condition. So such support, such many people have actually go in long in helping to reposition the public health sector in Nigeria, because we understand that the government are not exactly positioned to do every of these things. So there's need for private and public partnership. There's need for even private activities like project medical student specific and these are things that are very doable, because a number of medical students are doing fantastically well across different medical student associations. And so they are quite obtainable too. And so it shouldn't be a problem. But I'll be ending now, and then at the panel session, you can ask our questions that I may be able to elaborate more on some of the points that I expect. Thank you very much for the opportunity.
Thank you very much, Mr. Akinbelade. We'll be having our next speaker now. Mr. Matabo Victor. Citation will be read by Damilola Akinbelade.
Mr. Victor Matabo, the pioneer of change makers JOS, is a positive-minded, success-driven, goal-oriented, and innovative medic, desire to use his mind and body to express the highest and truest form of himself as a human being in the space and time that he embodies, influencing humanity laudably and creating a present that promotes progress out of the abundance of experience, mostly in public health leadership, while remaining teachable. As a team player, knowledgeable and competent leader, he has identified the challenges and dissatisfactions confronting students and young people locally, and have preferred solution which qualifies him as a global thinker and a local actor. His zeal and commitment has earned him the opportunity to serve in various leadership positions, and also made him represent his country at several high-level global meetings through the unalloyed bond between the Nigerian Medical Students Association and International Federation of Medical Students Association. He believes in caring for people around him, as that to him is the beginning of leadership. Welcome, sir.
Thank you very much, NiMSA. I'm so grateful to be here with you. I believe everyone can hear me. I'm so honored and I'm so happy to see NiMSA grow in this cadre. I began in NiMSA around 2018, NiMSA SCOPH, and I am so happy to be back to give back also to the standing committee that made me, I'll say. So I'll be taking, without waste of time, the transforming mindset and capabilities for creative and innovative solutions. Yes, so we can go to the next slide. So without waste of time, we'll get to know that leadership in the public health sector is very, very important in repositioning this sector in the country. And can we go to the next slide? And that leadership positions or leadership roles that we just kind of just see, it's not really the most pivot or let me just say, it is not really that more important than leadership roles in each, or leadership training in each sphere, like say the public health students, public health professionals, and also even the medical students we have around us. So can we go to the next slide, please? Okay, so the World Health Organization has already marked that Nigeria has the largest stock of human resources for health in Africa, but our health workers are still not enough to render these essential health services. So as I was saying, it's actually very, very important to train our health workers and also students in the health sector, and in order to transform this sector we are talking about. Next slide. So creativity, innovation, and entrepreneurship are important concepts, I would say, and they're critical for the advancement of healthcare in Nigeria. So within healthcare, it is important to recognize that creativity is the first step for innovation at any level within the organization. So we are not just looking at the healthcare professionals. We are not just looking at people who have big roles in the healthcare system. Even medical students can be innovative. Even medical students can be creative. Medical students can bring about change in the little way they can. So innovation is a necessity for healthcare now and in the future, particularly with the growing demand on the healthcare system driven by an aging population, an increasing prevalence of chronic diseases and illnesses, and changes in patient needs with requirement for more personalized patient care. So we can just see, can you go to the next slide, please? So we can see that medical students are not left behind in this repositioning. So creativity is thinking of new things while innovation is doing those new things. So you have to think before you act, okay? Yeah, so innovation is a question of mindset. So, and creating that mindset precedes everything else. In my opinion, is the innovation mindset that overrides the aspects of human nature that are often holding back innovation in large health institutions in the country. So how do we create an innovation mindset as medical students in the health sector? So I said I will be quite brief. So we'll list up those points, about 5 points to see, okay, how can medical students be quite innovative? Next slide, please. So we have to be open to change, okay? So we have a whole lot of traditional things that have been happening. We have a whole lot of ways we've been doing public health advocacy. For instance, when we held on public health advocacy in 2018, it will be different now because I think we are supposed to be open to change. We are supposed to think more deeply. A whole lot of things have happened in the world that we are supposed to like reposition in ways we have acted before to new methods we are moving on with now. So to be open to change means to admit and embrace. Can we go back to that slide? To admit and embrace the notion that the world is in constant transformation and all areas of society are challenged by this change. This itself is a first step to understanding whatever will be taught in this summit and afterwards. So for us to be innovative in solving problems, we need to be open to learn new things. So I thank the speakers for sharing a whole lot of fantastic ideas. And for medical students, you have to be open to learn from whatever has been said today and yesterday. Yes, so, and then afterwards, because you need to be open to change before you can accept it. So if it's difficult for you to accept change, you first of all deny it. And then you will find a way to defend what you already know, okay? And then you will be depressed because it will not get to work again. So before you get to accept. And so a whole lot of time will be consumed in that process of denial. Can we go to the next slide? So I am a medical student, as I've said, and I according to the profile, I am still like, I'm just a 6th-year medical student, and I hold a whole lot of activities when it comes to the public health and advocacy and leadership training. So we basically work with the International Federation of Medical Students Association, IFMSA, which is a non-governmental organization which embodies medical students, millions of medical students from over 150 countries, yes. And so we actually bring up new ideas every day, every time new ideas come up. So, and if you are not fine-tuned to accept new changes, you will be lagging behind with arguments and denial. And so you tend to see that solving problems in your locality will be quite difficult. So we have to embrace creativity also. The other aspect of an innovative mindset is truly to embrace a creativity. So an innovator's attitude is that creativity is a solution to problems rather than a traditional scientific method. Yeah, so the urgent shift we need in leadership in the health sector is to move from traditional style of leadership to globally prescribed transformational style, where the leaders allow followers to make innovative suggestions, contribute to decision-making, and participate in the tasks of healthcare delivery. I thank the Honorable who had mentioned that students can meet their representatives, House of Rep members, their senators, the politicians, to give in ideas. So we are not left behind. We have a task to play.
We have a role to play. Can we move to the next slide? We have responsibility to hold on to, that we can meet our politicians and tell them, okay, we need to do this and do this the other way. We've been doing this way, and we have been getting low yield or low result. Okay, so we have to do things better. We have to think in a different direction. We have to increase funding for healthcare. We have to do a whole lot of things to see that, yes, the common man gets to benefit from primary healthcare. So a whole lot of things need to be done, and that is advocacy. Thinking of policies, you help in the jurisdiction of politics. Not all representatives are healthcare professionals. Yes, so you'll find people who I read different things in different fields, so but they will take decision on health. So how do you do that? You have to help them. Okay, you have to go and communicate to them. We have to meet them and make them understand some of these things. We have to make them understand the impact of some policies to us. So you have to think big also. That's the third point. Today, most academic researchers and experts on innovation agree that innovation is more than just incremental improvement to what existing health products and services. So this leads to the point that innovations requires an ability and the courage to think bigger and beyond the current norms and truth in the health sector. So innovation is about stretching one's thoughts out of everyday ordinary thinking and analysis. Okay, that's fine. So we just believe that in public health, I've always envisioned that, can we go to the next slide? I've always envisioned that we have the responsibility to reduce the burden of patients in the hospital. So how can we reduce the burden of patients in the hospital? We have to be serious with advocacy in public health. We have to be serious in maintaining new ways, like adopting new ways to see that we prevent diseases. So the essence of public health is to reduce the number of sick people coming to the hospital. How do you reduce that? You meet them in their localities, you meet them wherever you can meet them. Many people do social media. A whole lot of dissemination of information can be done on social media just to see that people prevent diseases, people prevent health challenges, and then we reduce the burden of healthcare and the burden of people coming into the hospital. So you have to show courage, okay? Yes, as medical students, you might feel timid. As people who are less knowledgeable in issues of health, you might feel timid, but you have to show courage. Innovation doesn't happen unless organizations and the innovators within them have the courage to constantly rethink how things can be done. So in 2016, we went into localities, we went into villages, we went to share information about health related diseases and diseases that could hold a whole challenge or kill inhabitants of a community. Now we have a broad news fair of doing things also. We can go to social media and raise awareness on diseases. We can do adverts, we can do a whole lot of things. We have a whole lot of, many people use TikTok now. You do TikTok videos about health issues and you tend to reach a whole lot of people. We have millions of Nigerians on TikTok and a whole lot of that. So these are innovative ways. So we can't just keep doing local things or traditional things and while the world is evolving, okay? Yes, so it takes courage not to conform to widespread beliefs and popular truths in big organizations or big hospitals or big things. So we have to constantly be courageous to challenge the status quo by bringing up new things, okay? New ideas that will foster the prevention of diseases, new outcomes that will foster funding or will foster the policies, good or right policies that will be implemented in our country. It takes courage to challenge proven strategies and successful products and services before they go into decline. It takes courage to question management and colleagues for doing things the way they have always done. I mentioned that. It takes courage to constantly problematize and be that one person who always goes against the grain and tries to think about things from a different angle. Yes, so you have to think about things from a different angle. You have to communicate with your team. So we have local officers in SCOPH, we have the National Executive Council. So you have to think outside the box. Yes, what is going on in Denmark? What is going on in Canada? How can we incorporate it to Nigeria? Yes, so activities we had with some European countries sometimes back in 2020, we shared a whole lot of ideas on how we can reposition health, like let's say public awareness or public health awareness in our localities, and we shared ideas on how we do it in our own countries. And I got to see that, oh, so these guys actually do these things this way, and this is actually very fantastic. We never thought about it in our own country. So a whole lot of things you get to share and ideas you get to learn from people around. It goes a whole lot to help you in your own local community also. So yes, it takes courage to be vulnerable rather than playing it safe. According to established business practice, it takes courage to venture into the new and uncertain, risking failure. Yes, next slide. So as medical students, I've said, I'm pointing out of medical students because I am a medical student too. Yes, and I am very particular, and I know the impact of medical students in the health sector very, very well. So medical students, for instance, the Honorable has mentioned how we can also influence decision-making in our country. Yes, so you meet your local representatives, you meet your provost, you meet your councillors, you meet even people directing health services in your country. For instance, I constantly meet the directors of public health in my state, that's in Plateau State. I constantly meet the chairman or the coordinators of rollback malaria, the WHO coordinators, and we brainstorm, okay, this and this. And they'll be wondering, oh, medical student, you're thinking like this? Yeah, so I allowed myself to learn new things. I allowed myself to incorporate and network with people who have done or proven strategies that have worked in their countries, and I have decided to adopt those things in my own country so that we can experience better healthcare. Okay, so you will need to think and act fast. So, if you can see, creativity is about thinking, and then innovation is about acting. So you need to act. You need to act fast. You need to do all those things on time. Yeah, so you don't get an idea that is supposed to be used in 2020 and you allow it to be used in 2025. The innovation comes up and goes. You get it. So the world keeps evolving. The world keeps moving. You have to do your best to see that you act accordingly, act on time. Next slide, please. So I'm getting to conclude. I guess this is going to the last slide. Yes, so in conclusion, to sum up all of these obstacles, there are 5 main ingredients to an innovation mindset. So we need to be open to change. As I've said, we'll have a bias towards creativity, an ability to think big, unrelenting courage to challenge the norm, and be characterized by speed of thought and action. Thank you very, very much. And I believe medical students, healthcare professionals, and our leaders around will do a whole lot when we allow ourselves to be quite innovative, to activate our thinking, to also think outside the box, to also accept good stuff that will work in our country. And this will go a long way in helping to reposition the health sector around us. So I believe that the health sector is around you in your immediate community. Don't see it as a big thing. Don't see it as a nation. Just see your immediate community. How are you able to influence change? How are you able to influence decision-making that will promote health in your local community? So as a medical student, as a local officer, as a NEC member, you should see your immediate community and the country at large as a sphere that you can impact. You can bring up ideas that will help profile or bring about good or better lifestyle in your own sphere or community. Thank you very much, NiMSA Nigeria. Thank you.
Thank you very much, sir. That was indeed an insightful one. Shortly now, we'll be having our next speaker. I'm excited to announce to us all that we have the Director General for Nigerian Institute of Medical Research here with us this afternoon, Professor Babatunde Salah. Professor Babatunde Salah will be taking the next session. A citation will be read by Ms. Ayambule Rochelle.
Okay, I will take the citation of Professor Babatunde Lawal Salah. Professor Babatunde Lawal Salah is a seasoned physician, teacher, researcher, and administrator. He is currently the consultant physician in Nigeria. His foray into medicine and surgery, MBBS, from the University of Ibadan, and further went on to become a fellow of the West African College of Physicians in 1994. He became the head of the Department of Medicine in both Institutes of Medicine, the University of Ibadan, between 2014 and 2016. By dint of hard work and good clinical practice, he was elected fellow of the Royal College of Physicians of Edinburgh in 2014 and the Royal College of Physicians of London, Nigerian Medical. Sorry, I didn't get that, sir.
Now you can just end it there.
Okay, I'll continue the citation.
Just finish the citation there. Are you done?
Okay. No, sir, not yet, sir.
Please go ahead.
Okay, sir. Professor Salah was the chairman of the Nigerian Medical Association in Oyo State, 2002 to 2004, assistant editor-in-chief, African Journal of Medicine and Medical Sciences, 2012 to 2014. Was appointed the editor of the Tropical Journal of Nephrology, the official journal of the Nigerian Association of Nephrology, 2005 to 2012. Having become a member in 1991, vice president of the association in 2012, president-elect of the association in 2014, and later president of the Nigerian Association of Nephrology in 2016. Over the years, he has worked on hypertension and kidney diseases with grant support from the College of Medicine and Senate of the University of Ibadan, the Mark Harter Foundation, and 5 NIH grants as both site PI and in a project with multiple PI on the H3 Africa Kidney Disease Research Network Consortium in collaboration with the Department of Public Health Sciences of the Loyola University, Chicago, University of Michigan, USA, the University of Arizona, and the University of Ghana. He is currently a member of the General Assembly of the European and Developing Country Clinical Trial Partnership, EDTCP, and also a member of the WHO CDR Joint Coordinating Board of the WHO CDR. He chaired the Disease Endemic Country Committee of the WHO CDR Joint Coordinating Board for 2 years. He has been appointed as temporary advisor to the WHO on many occasions. Professor Salah was appointed Foundation Fellow of the Nigerian Academy of Medicine in 2019 and Fellow Nigerian Academy of Science, FAS, in February 2020. He is the Chairman National Health Research Committee and Chairman National COVID-19 Research Coalition. Is a member of Third Fund Research and Development Standing Committee and Board of Experts of the CBN Health Sector Research and Development Innovation Scheme. He has discredited more than 170 journal articles in both local and international journals, including 2 books, one on nephrology for laypersons and the other is autobiography. Professor Salah is married with 3 children. Welcome, Professor Salah Lawal Babatunde.
Thank you very much. I need to share my screen. I need to be allowed to share my screen. Mr. Chairman, how many minutes do I have to make this presentation? Hello, can you hear me?
Hello, sir, we can hear you, sir.
Yes, okay, I'm trying to share my screen, so.
You can share your screen now, sir.
Okay. Can you see it?
Yes, sir, we can see it, sir.
Oh, okay. Thank you very much. So how many minutes do I have to make the presentation?
10 minutes, sir.
How many?
Sir?
I didn't hear you. How many minutes?
10 minutes, sir.
10.
Yes, sir.
That is unfair, but I hope you are going to be able to understand the presentation in 10 minutes. I could, if you want me to talk in 10 minutes, then there wouldn't have been any need for me to make a slide, really. Well, let me just thank you for asking me to do this all the same. And to say that research really is really the soul that we have, whether it's public health or any other forms of international health, as it were. So it's really very important because research provides solutions to some of these challenges. Public health itself can be described as a science of protecting or promoting the health of the people. Basically, public health prevents people from getting sick. And then, of course, the individual action, the environment, the society has effect on the public health. 25% of global disease burden has been attributed to the environment and the relationship between environment, the individual, and community. And therefore, it's very important that if we want to ensure good health and reduce our own very poor health indices, we needed to look at research, as it were. Most of the changes in the environment, like you can see on this screen, have been noted to have effect on public health. In Nigeria, these are the major things you see. I'm not going to be able to talk much on them, but basically you can see flooding and then open defecation, as it were. The major challenges of public health in Nigeria, again, issue of flooding, poor waste management, poor water quality, and coal.
That means you're looking for the money.
But the thing is that,
some people, some people seem to be interrupted.
I mean, somebody else who said that, okay, you don't to pay. No, they will not agree.
Some What? Hello, can you hear me?
Yes, sir, we can hear you, sir.
Thank you very much.
We can hear you, sir.
What research does is to track key environmental challenges so that solution can be found. It can inform policy and then, of course, reduce different types of public health challenges that we have. Now, what's going on? This slide is not changing. Okay. So health researchers really create ideas. They test ideas, they try to answer questions, and of course, come out with that solution from that question that had been asked. Basically, research during pandemic creates an opportunity to collect information that can contribute to improving outbreak control measures, especially when we talk about clinical trials, which is what we to develop and produce our own vaccines. We are not able to vaccinate our people as at when due. And now we talk about vaccine nationalism. People who produce vaccines certainly will not leave their population to come and serve our population. So health researchers will look into the population, identify problems, take it to the lab, investigate it, provide solutions. If they find out that the solutions can work, then they come to clinical trial. And then if it passes clinical trial, then it becomes something that the government can say, pass policy on and ask people to use. So basically, we expect health research to answer the following question: how to manage and control the epidemic in question, then future preparation in the event of another outbreak. Now, are we preparing for another outbreak? How to prevent future epidemics and future outbreaks, and how to address knowledge gaps in various fields. All these can be done through basic research, clinical research, public health research, and of course, implementation research. Now, what we also do is identify critical problems and then research the benefits and the harm, and then provide solution to the public. It also uncovers trends, risks, and other factors such as whether biology, behavior, society, or environment play a role in the population's health. So we provide vital information about disease trend, especially in the area of drug development, vaccine development, and therapies. Public during the pandemic. One, by collaboration. You need to share your ideas with others. Somebody was talking about being creative and coming up with innovation. And you need to discuss this with others so that they can improve the idea that you have. This can be done through multidisciplinary and multi-site approach so that you don't have your own narrow field of experience alone to contend with the issues. Others will bring their own, and then this can bring solution. Again, you need to create interaction. This interaction especially needed to have been existing even before the pandemic. That happened between NCDC, Research Institute, the university, and regulatory agency. But we needed something that is more coordinated for us to be able to get better results than what we've had. And then the issue of clinical practice during pandemic. Oftentimes, when public health responses are being made, research is left behind. Now we have found out that we needed to work together. There has to be simulation of research and public health response so that public health response can be informed by research. And this has to come up with curiosity from researchers, careful examination of the literature, and then the existing work that has been done. Of course, we need also to train people who are specialists in public health, especially using the Nigerian Field Epidemiology Laboratory Training Program, which has contributed immensely to our ability to control the COVID-19 that we have currently. So in terms of clinical trial, we need to study and structure assessment of key factors that we need for us to be able to do effective clinical trial. Because patient-centered clinical trial has not been effectively embedded in public health response. That's why we must work together, the researchers and the clinicians, so that we can provide solutions to what solutions that are required during a pandemic or another. The NCDC did this very well by creating the National COVID-19 Research Coalition, which worked in concert with the NCDC. Especially in the area of kit validation. That was the only research we were able to do during this pandemic so that we can inform what kind of tests the NCDs can recommend for the Federal Ministry of Health for all laboratories to use in Nigeria. We must be familiar with clinical trial steps. Again, we were doing much of phase 3 and phase 4. We are not being able to do more of phase 1 and phase 2 because we are not coming up with our own drugs or vaccines. Even then, those who wanted to come and do this trial in Nigeria had issues. Some of them may be regulatory because the drugs are new and NAFDAC needs to go through them before they are able to register them. We need a lot of experience in the area of research protocol. We need participants. Of course, Nigeria has large, diverse population. We have plenty of hospitals, and we have skilled health practitioners that can do this. Meanwhile, we need to work on our regulatory system. In issue of ethics, during research pandemic, we have to be able to expedite action without necessarily compromising standard. Then the issue of inclusiveness in research, because in a pandemic, people sometimes may be locked down, and then the issue of consent, interview, for example, focus group setting, how do you get people to do this? Can you do this by phone? Some of these are challenges of research when we are in a pandemic. And one has to be creative to be able to ensure that when research is done, standards are maintained and are created. We need support and advice from people who know. For example, the NCDC worked with the WHO and other international communities and sought help during the pandemic. And we need to be able to mentor our younger people, put them in the forefront to be able to design clinical trial and be able to work with it and produce good reports. What we've been able to do quickly during the pandemic in NiMSA is to track the disease through our free test driving. And we're able to track the disease through and predict the next phase of the disease. You can see the 4 phases that we've had in Nigeria, and this is one way of being able to track the disease. And then we're able to also do what we call the zero-epid of COVID-19 within the population. So as at the time the NCDC was recording less than 100,000 or thereabout, more than 23% in Enugu and Lagos State, for example, have had contact with the disease. This is the power of research to tell it the way it is. And then NAMA came up with a traction kit, which is used in the process of diagnosing COVID-19. And then we produced 2 test kits. Again, one of it which can bring results in less than 40 minutes. And of late, we also added yellow fever and Lassa fever test kits. These are steps in tracking and surveillance in diseases because you need to first make diagnosis to be able to stop further spread of the disease. And these are the first steps that are required, especially when you have a pandemic. We are lucky to be involved in the sequencing of the first case. And the first case was actually sequenced in NiMSA through our next generation sequencer. And since then, we've been contributing to determining the variant circulating in Nigeria, supporting the NCDC in providing solution to the pandemic. And last slides, our efforts in trying to produce homegrown vaccine. We're trying to do a subunit protein vaccines, which we produced at some point and got to the level of animal trial, but failed because it was not able to elicit adequate immune response. This is basically more of an experience than our attempt to really produce the vaccine because we haven't had that experience before. Again, this is what public health response can bring and what research can offer to ensure that we are able to provide solution. I believe this is my last slides. I'm sorry that I have to rush through these slides. I didn't expect that I was going to spend 10 minutes. Thank you very much. I hope you understand the lecture. Hello? Hello?
All right. Yes, thank you very much. We are very sorry for the short time. It's obvious that we had a whole lot planned for us. We are very sorry. We thought we communicated that earlier, but unfortunately, sir. Thank you very much, sir. We are very grateful. I think we learned a lot more about what the Nigerian Institute of Medical Research is doing under your leadership, sir, in tackling public health crisis. We have questions. We might have questions for you. So those who have questions can please drop their questions in the chat box. Those who are joining live on Facebook should also drop their questions in the Facebook live comment box. We'll check everything. While we are looking out for questions, we would like to inform you, sir, that we have other speakers on the call, including Honorable Samuel Adejari, who is the Vice Chairman, House Committee on Health. We have Dr. Adewale Momodu, who is the co-founder of Onkopadi Technologies. We have also other speakers who might like to say hello to you and say one or two things in addition to what you said, sir. So we'd like to leave the floor open for them, sir.
Let me just quickly recognize Honorable Adejari, who has been a friend and colleague. I didn't realize he's on the call. Your Honorable, you are very welcome.
Thank you, Prof. That was well done and well said. NiMSA is our place, and you are doing wonderfully there, sir. God will continue to bless you and help us better in this country. Thank you so much.
Thank you, sir.
Thank you very much, sir. We are very grateful. So we'll be having questions from the chat box. If there's any, please kindly put it in the chat box. And if you also want, you can raise your hand so that we can unmute. And then we also had a session on research earlier in the meeting. I was anchored by Mr. Gabriel, okay, founder of MedLab Co. So when we have questions now, we'll be directing it to our Prof as well as Mr. Gabriel. So please, let's drop our questions so we can address them. So we have the first question, sir. It says that what was the name of the vaccine the NIMSA worked on then? And then what was the major challenges of the process, sir? That's the first question, sir.
You want me to go ahead and answer now?
Yes, sir. Yes, sir.
Well, we did what was called a protein subunit COVID-19 vaccines. What that means is that we synthesize the spike protein of the virus and then got a company outside Nigeria to produce it for us because we do not have the capacity to produce the synthetics. And that came back, and that was what was tried in the animal that I showed you. If it's been successful, we would have given it a name, maybe NIMSA COVID-19 vaccine, but it wasn't successful, so there wasn't something to make noise about. But what it gave us is an experience on how best we can tackle it. We are back to the lab again, and we are lucky to get TETFund to fund a consortium of us to the tune of about 450 million, and NIMSA will have 100 million out of that. University of Sokoto, NVRI, National Veterinary Research Institute in Jos, and University of Jos, and one other institution. 4 or so or 5 of us have been funded to try and work on homegrown vaccine development. And our target is COVID-19 and Lassa. Again, the idea is not to produce COVID-19 vaccine now to struggle in the market with what we already have. But we are now looking at several strains that are coming up in case in future, newer vaccines may need to be developed to tackle those strains. So that's what we are working on currently.
All right, sir. Thank you very much, sir. Thank you so much. We have one of our speakers who has a question coming. Dr. Adara, do you have the floor?
Okay. Thank you, Prof. Sir. Thank you. I've been following a lot of your work closely, sir. So thank you so much for sharing. So I just wanted to ask as regards, so I know you've talked about COVID and you've talked about Lassa fever, and I wanted to ask, what is NIMSA doing in the space of Ebola? Because I know that Ebola was one very serious disease that sort of struck us and affected us in Nigeria. So what works are still being put in place to ensure that we don't have a repeat of that in Nigeria? Thank you.
Well, thank you very much. We have a group now working on what we call viral hemorrhagic fevers, and that includes Ebola. And we have 5 PhDs who are currently on the field. The research started about 2 years ago, but during the lockdown and all the protocols and they couldn't be able to continue that. So they are just back to the field now. And what are we doing? We are looking at vectors and monitoring if they have the viruses in them of any of the viral hemorrhagic fever. Particularly for Lassa, we worked in Delta, where an environment that was found to be infested by mosquitoes that can transmit Lassa, yellow fever, was treated with insecticides. And we went back to the field after the treatment, and we still found out that a large majority of the mosquitoes still harbor the virus. Of course, what that means that that insecticide is not effective, or that the mosquitoes have developed resistance to it. These are some of the very useful information that can provide public health support from research institutes. So for Ebola, we continue to monitor surveillance and screening. And unless we find one, we may not be able to do anything specific. Ebola needs to have what they call a BSL-3 or BSL-4 level of laboratory to be able to work with. Although we have a BSL-3 level of laboratory, so if we have any opportunity, we should be able to do more about it.
Also, so just to add one last question is to also ask that, are there plans towards making vaccines for some of these viral hemorrhagic fever, aside from yellow fever, to be locally made in Nigeria?
The idea actually not just for COVID or Lassa. COVID or Lassa is just for us to use that as an experience to prove the concepts. But the idea is to develop vaccines to any disease at all, ravaging our population, or any new disease at all. So that if we have a new outbreak today, we will be able to partake in it. And we are not going to be waiting for others to produce vaccines for us to use. So this is the idea. And that's what we are working on that platform.
Yeah. Thank you very much.
Thank you.
All right, thank you very much, sir. We on the Facebook calls, we have a question which says that is there internship opportunity for medical students who are members of NiMSA at NiMSA? Or if that was that, can we work out something?
Oh, there are a lot of undergraduates and PGs who come to NIMA for internship. So what you need to do is just send in your application, and it goes through the process. I will get back to you.
All right, sir. Thank you very much, sir. We are very grateful. Let's show our appreciation to our dearest profs using the chat box. I think a good number of us have been saying thank you very much, sir. We are very grateful. We are happy that you accepted our invitation to speak to us this afternoon. Thank you very much, sir. If there are any other questions, I think we'll take them as the session proceeds.
Thank you.
Thank you too, sir. Thank you too. So right about thank you very much, sir. Thank you. Dr. Adara express her appreciation as well. Let's fill the chat box with thank you messages for our dearest Prof. He has done a very wonderful job. Thank you, sir. So next we'll be listening to Dr. Adara Momodu, who due to difference in time zone could not we were a bit unsure if she would be able to make it. But then she had to, wake up as early as 4 a.m. at her location just to join us this afternoon. We are very grateful for this huge sacrifice, man, and we are happy to have you. So very quickly, we'll be having a citation before we move into listening to her for the next 10 minutes. So please, let's have a citation.
Okay, I'll be taking the citation of Dr. Adara Momodu, MD. Dr. Adara Momodu, MD, is a culturally diverse community physician and healthcare innovator. She is co-founder and chief operating officer of Oncopadi Technologies Limited, a digital health innovation company empowering confident cancer care decisions by patients, clinicians, and healthcare companies. She solves cancer care issues sitting at the intersection of technology, healthcare, and innovation. Her passion for challenging the status quo propels Oncopadi to churn out data-driven, community-oriented solutions that have gained global recognition. US Astella Oncology, MTN Nigeria, Microsoft for Africa, Leap Africa, Shelit Africa, UICC, AORTIC. She is a 2022 Tech Women Emerging Leader, an immersive training and mentorship program in Silicon Valley, sponsored by the US government. Welcome, Dr. Adaora Momodu.
Thank you, guys. Thank you so much for the opportunity to be here. And just as Timothy had explained earlier, my apologies for joining in late. We got the timing mixed up. But thank you for the opportunity. So I'll just go straight into my discussion. But just before I do that, can I confirm that everyone can hear me clearly?
Yes, we can hear you, ma'am.
We can hear you, ma'am.
Okay, fantastic. All right. So I'll start with of course, my topic, and I'll start with two questions I'd like to ask. So I know my topic, so I'm supposed to talk about the role of medical students in bridging the gap between healthcare facilities and the communities. And so I would like to ask us as medical students, what roles do we think we can play in supporting our already existing healthcare system? Do medical students have, or do medical students improve patient care in any way? And for me, the answer is yes. The answer is yes, basically because medical students sit at that intersection of learning, knowledge acquisition, and sort of getting first-hand experience with many of the patients in our hospitals. For many of us in medical school, I know that there are just about 42 medical schools in Nigeria, with only 17 being federal and the rest being state-owned, right? So we are at a larger advantage, even though that the medical workforce is still getting depleted, but medical students still have a vital role to play. For me, back as a medical student, I started my career in the oncology space as far back as a fourth-year medical student. And for me, it was just a feeling of feeling helpless, right? So I lost a friend to hepatocellular carcinoma in fourth year, 400 level medical student, learning and training at the College of Medicine, University of Lagos. And I could remember feeling helpless, and I could remember feeling that I couldn't contribute anything, to prolong his life. I couldn't contribute anything to impact the outcome of care he had received. I couldn't contribute anything, to saving him in general. And also, as I progressed along, as a medical student, rotating from one department or one unit to the other, I was more in tune, or I was more in reality with what cancer patients do face on a day-to-day basis. And I think that applies for many of us, is the fact that we are actually at the forefront, or we are actually at the center of the problem. And the onus lies on us to sort of identify this problem and sort of find simple solutions, right, that can address some of these problems that we face. For my friend, in the case of my friend, the problem was just simply lack of information and lack of access to the right doctors. By the time he found the clinical oncologist who eventually took care of him, he found them pretty late. And by the time a diagnosis was made, he had only less than 3 months to live. And the case is the same for many people. Many patients are stranded at home. Many patients lack the right information. Many patients do not have access to the right doctors, maybe because of finance and so many other things. But I think that's really where we as medical students come into play. And I think NiMSA does a fantastic job in terms of medical outreach. And medical outreaches, as much as they play a very significant role. They play, most importantly, a significant role in information, in providing access to information. So I think medical outreaches are a good avenue for medical students to go into the community, to sort of share information to these people and sort of move patients or move people from the communities and drive them into the hospitals. Because at the end of the day, the goal is for patients to leave the communities and get the care that they deserve or the care that they need in the healthcare facilities. And so that's really the case. And so for me, that was really where Oncopadi started out. Oncopadi for us started out as a simple solution, a simple digital solution that would provide patients with the right information to cancer, because when you go online, there's a myriad of information, and cancer, for one, is something that is significant. People associate cancer with death. People are scared when they get a cancer diagnosis. People are lonely. Cancer is an isolating, experience for many people. And nearly 125,000 Nigerians are diagnosed yearly from cancer. And so for us, it's really providing information, providing them with the right support that they need, and providing them with access to clinical oncologists faster, moving them from the communities into the healthcare facilities, moving them from the communities into the diagnostic centers, where they can get the care that they need, where they can get the care that they desire, and where they can get the care that is right for them. For us, for medical students, I would just say something really short, is to say that, so for us as medical students, I would say that what is really important for us is really identifying problems that are around us. Every day we go to the clinics, we have clinic rounds, we have ward rounds, we have clinical rotations. What are some of these problems we encounter on a day-to-day basis? And I would say I challenge every single one on this call to sort of pick a problem. By the time we begin to tackle problems that are peculiar to us and profess solutions to those problems, then we'll be able to provide the support that our healthcare system needs to a very, very large extent. Because most of the challenges or the gaps in our healthcare system really just lie around access to information, access to the healthcare workers, and of course, have access to the right support and access to funding. Thank you. So I don't know if anyone has questions, specific questions. I can take questions now, and if not, that will be all from me.
Thank you very much, Ma. That was a very brief and enlightening session. And I think I'm particularly wowed by how you use your story to actually create that impression and shed light to a whole lot of things. Thank you very much. So we'll be looking out for the chat box. If you have questions, please kindly share your questions in the chat box, and of course, let's show our appreciation to our distinguished speaker as well, who had to make our time out of the inconvenience to be with us today. Thank you very much. If you're also on the Facebook Live platform, please drop your questions in the comment box as well. We're on the lookout for them, and we'll sure bring it here.
Thank you. Hi, Kola. So yes, certainly there are internship opportunities for us at Uncle Paddy. A large number of people that form the workforce at Uncle Paddy are actually interns. Currently, Uncle Paddy has had more than 17 medical students intern with us over the course of 5 years that we started working. So yes, so there's an opportunity for that. So I'll just drop my email and my WhatsApp number, and you can just reach out to me there. So yeah, so I've just dropped my chat, and you could write an email to me and copy the other email address I added there. For one, I think one of my greatest moments in Uncle Paddy is one of the mentees that I've actually had the opportunity to mentor. She started off as a medical student interning at Uncle Paddy, and she did that for about a year. and then she progressed into like a full-time staff at Oncopadi, which is Dr. Ilola Thomas. I am so proud of the work she continues to churn out every day at Oncopadi. So yes, there are opportunities. The beauty about working at Oncopadi is that we're able to connect you with real life experiences, right? Real life experiences in creating solutions. One of our most formidable work currently now is what we call the Oncopadi Hub. So the Oncopadi Hub is a hybrid working space that allows for clinicians, for medical students, for academia, for staffs, for anyone who really wants to get into healthcare innovation. You have an idea, you don't know where to go with your idea, you don't know how to build your idea, you don't know where to start. Come to Oncopadi Hub. We'll be able to help you, guide you, help you with the right resources to help bring that idea to life. Some of the startups we've incubated, we have one called the Medical X Lab. So the Medical X Lab, we're a group of, I think, 300 level and sort of what, how some of their medical books, right, they could put it on a system that could be accessible at any point in time and people could ask questions. And I really found that like a very, very cool project. Another incubation project we're working on is with 600 level medical students of the University of Lagos also. And what they're trying to do is sort of build like a bio blood bank, right? So they're working on that project and it's really fantastic. And that really stemmed from one of them, Esther, I remember her name. So Esther almost lost a friend due to the unavailability of blood in most of our tertiary hospitals. And so the idea came about to say, oh, how can you get a centralized system that sort of keeps record of where blood is that you can get at any point for your loved one? So yeah.
All right, thank you very much, Ma. I think we have somebody whose hands are raised. So Isaac Peter, you have the floor, please.
Okay, good afternoon, everyone. The question there is is there any portal made in order to make complaints of any hospital, no doctors that are not doing their well for a better health sector in Nigeria? Because I have a lot of hospitals that I've gone to. So there are these certain complaints that they are not doing their work to do. So I have them and I have some pictures regarding towards that. So my question goes that way. All these complaints, because you realize that the hospital there.
Mr. Peter, please.
Yeah.
That would help us all and save the whole house of lot of stress, please. Can you use the chat box? Thank you. All right.
Okay. Yeah, but I think just to answer the part I heard, so I think when it comes to like medical negligence, right? So such reports, and I believe can be made to the Medical and Dental Council of Nigeria, right? So I'm sure you can just write an email to, and there's a place on their portal where complaints can be made. You can provide such complaints on the Medical and Dental Council. You can also provide such complaints to the Nigerian Medical Association, and I think you can also provide complaints to the Association of General AGCPN PN. Yeah. So the Association of General Practitioners of Medicine in Nigeria. So I think those are local authorities that you can make complaints of, either hospitals or of one-on-one encounters with physicians or doctors or healthcare workers that I've shown that have been lackadaisical to their work. For hospitals, I think you can make such complaints to FEMA, right? I want to believe, because FEMA gives hospitals their accreditation and licensing. So I think you can make such complaints to FEMA, right?
All right, thank you very much, Ma. We are very grateful. Thank you so much for joining us. Thank you. Any other questions, we will have them in the chat box, and hopefully before the end of the session, we would also invite you to take them at the other questions. So let's show our appreciation to Dr. Adela, as you have always done by using the chat box. Let's drop this thank you emojis in the chat box. Let's drop the applauding, the clapping emojis. Exactly. She deserves that and more. Thank you very much. We also want to appreciate our other speakers who have stayed with us. Honorable Samuel Adejare, thank you. She has been with us since the start. We are very grateful. Our other speakers, thank you very much, everyone. Thank you to the DJ of NiMSA. Thank you. We are very grateful, sir. Now, very quickly, we're moving to the last session, and the last session will be a very short panel session due to time, so that we can round off by 3 o'clock, and we'll be having 2 of our speakers to be on the panel session in persons of Mr. Akingbola Adewumi, who spoke to us earlier, as well as Mr. Daudu Luananumi, whose citation will be taken very briefly, and shortly after then we'll have the short panel sessions. And if you have questions for them, of course, regarding volunteering, advocacy as medical students and any other thing, and even while that is going, if we have other questions that we think that some of our other speakers can attend to, we'll also bring them on board, and then they will attend to those questions. So over to the moderator now to take the citation of Mr. Daudu Luananumi.
Mr. Daudu Oluwanumi is an award-winning social entrepreneur and cybersecurity analyst. He has extensive experience in handling varying security threats, regulating data access, and leading various security task forces with high-profile data breaches, making the news lately. He's up to date on industry trends and technologies, and always remains one step ahead of all cyber attacks. It is his focus to ensure information within an organization remains safe and in the proper control. Daudu is a recipient of the 2021 Young Global Change Makers Award in the Rising Impact category by YEF Global London, 2021 Princess Diana Award Wales, UK, the most prestigious award and accolade for a young person in humanitarian service. Student Ambassador for Royal Society of Tropical Medicine and Hygiene, Lagos State University College of Medicine, and 2020 SME 100, Africa 25 under 25 Most Enterprising Young Nigerian Award. Let's welcome Mr. Daudu Oluwanumi.
Thank you very much for the citation.
Thank you very much for the opportunity. Can you hear me?
Yes, we can hear you.
All right, thank you, everyone. I want to recognize the presence of Honorable Dr. Samuel Adejare. Thank you very much, sir. I really learned a lot from your session. I don't know if Prof is still on the call. Thank you very much, sir. Thank you, Intire, for the opportunity. Thank you, Dr. Adawara. I really enjoyed your session, and I want to say I really love the way you are leveraging technology to help people living with cancer in our region. Yes, thank you very much, ma. I think you mentioned about a medical student who transitioned to become a full staff of Uncle Fadi. Yes, myself and the wonderful doctor, we were both fellows at Art in Medicine, and I was really impressed by our passion for medicine, and also our work in community projects like this. I'm not surprised in any form. Thank you very much, man. And I really hope that medical students on the call, will leverage opportunities like this to intern, at Uncle Paddy, and also gain research experience. However, so I really have, I'm obsessed about technology and leveraging technology for healthcare. I participated in the Fishbowl Challenge recently, and I was able to get to the semi-final stage, where myself and my partner from Zimbabwe, we developed a telehealth platform, to help people in Zimbabwe, access, healthcare consultation remotely. And it is so shocking to note that in the whole of Zimbabwe, there is no telemedicine platform yet. It really shows how, backward we are in Africa, and, the chunk of work we still need to do. And I just want us to, quickly see technological innovation from this lens. So let's take a critical look at, the impact of COVID-19 on healthcare. Although COVID-19 affected everyone globally, and I would like to, appreciate platforms like Wellvis. Wellvis during the COVID-19 pandemic, helped people in developing countries like Nigeria access, information as regards the viral infection. And Wellvis is a health tech startup that took part in Venture Platform Foundation's COVID-19 Innovation Challenge. Wellvis developed a cost-effective solution that addresses, this problem by leveraging the proliferation of mobile phones. This company created a COVID-19 triage tool, which was later adopted by South Sudan, that helps, people identify their risk level of contracting this virus and educating them on what to do next. This simple solution can also be applied to many other illnesses that are prevalent in low and middle income countries. We all know that in Africa, we have a teeming population, and it is not shocking to hear that Africa has the world's highest burden of infectious and neglected diseases. Oftentimes, we face a rapidly rising burden of non-communicable diseases. Nonetheless, Africa is home to 11% of the world's population, and we consume just less than 1% of global health expenditure. However, we carry 25% of the world's burden of diseases. The hardest age groups are women and children, and half of the world's deaths of under 5 are on this continent. My nugget goes thus. Innovation will always be synchronous to national development. Let me take a critical analysis of Help Mom's innovation led by Dr. Abiodun and his team in the area of maternal and child health. They have helped harness the power of mobile technology and low-cost innovation, and they have also, helped deliver life-saving health information to pregnant women on their mobile phone device. They've also provided clean birth kits for women in deprived and underserved communities, and also help, remind women of their babies' vaccination appointments through vaccination tracking system, and also train birth attendants using their e-learning platform provided on Help Mom free mobile tablets. According to Sir Alfred North Whitehead, ideas won't keep. Something must be done about them. It's easy to come up with new ideas. The hardest part is letting go of what worked for us as a nation many years ago, but we soon be out of date, or however, already out of date. Our imagination will not only become the uniquely human capacity to drive change and bring about national development, but the fount of all invention and innovation. In its arguably most transformative and revelatory capacity, it will become the power that enables us to empathize with Nigerians whose experiences we have never shared. At this junction, I would like to say that leveraging technology in healthcare at this point in time, has become, quite inevitable. And these are the following things it will help us to do. It will help us, bridge the gap between healthcare service delivery and also ensure that, patients can access, can access healthcare services remotely, such as doctor's consultation, provision of medicines, drugs, and also vaccination exercises. At the last Twitter space that was organized, I tried to share about the LinkedIn poll I did sometimes ago, where I asked over 30,000 of my LinkedIn connections, how best, they will prefer to, have their hepatitis B vaccine. And most of them picked remotely. They would like to have their hepatitis B vaccination exercise done at the comfort of their homes. So it is in no news that Nigerians are beginning to see the need to access healthcare services remotely. So the birth of telemedicine has come to stay, and the input of technology, leveraging technology in this aspect, will be the driver to help us achieve this going forward. Thank you very much, and I look forward to a wonderful panel.
All right, thank you very much. I think that was a very great way to come in. That was a very great way to start things. So very quickly now, we'll start with the session. Just to check, Mr. Adewumi, are you with us as well?
Yes, I'm here. I'm still with us.
All right, thank you very much. So first question I would ask is, what's the number one way you think we can make substantial difference as medical students? The public health sector and all, volunteering, innovation. What's the number one way? Can you give practical examples?
Okay. Okay. Thank you once again for this opportunity. And I'd like to say that the number one way by which we as medical students can help change the tides with respect to the public health sector in Nigeria is that we pay active and deliberate attention to studying medicine and surgery. Do you get it? And so because to dissolve a problem, to resolve a problem, or to ideate the most appropriate solutions to problem, you need to have adequate and profound knowledge of the problem statement itself. Do you get it? And so you need to understand the processes that it will take to ideate such solutions to the problem. And so I feel like having profound knowledge in medicine and surgery should be a first starter to helping to change the tide in the public health system in Nigeria. Take for example, if there is if there's a pandemic breakout of, say, a viral hemorrhagic fever in Nigeria, so it would require every medical practitioner, every medical professional across all levels to begin to create maximum awareness, health promotion, and add an awareness that such pandemics can be curbed in this part of the world, because most people are not entirely privy to medical information, and most people will still require that these informations are adequately broken down to layman terms before adherence can be seen to occur. And so it will take all levels of medical professionals to begin to create rapid maximum awareness of or a medical student that has adequate knowledge of the preventive strategies that should be in place, of everything that is applicable to the condition, to be able to create the maximum awareness. For example, another example is during the COVID-19 pandemic. I remember having to search online to understand the pathophysiology of the COVID-19 pandemic, of the COVID-19 disease itself. And so all I could see online was speculation, but still those speculations at least empowered me with the basic concepts, the basic knowledge by which the COVID-19 virus was thriving, and it helped me to understand how and why the immunocompromised people were at higher risk of coming down with COVID-19 complications. And so I was able to properly communicate that in most of the activities we participated. I was able to communicate that in most of the low to middle income communities that I visited during the COVID-19 pandemic. And so it helped the information to flow and to thrive well. So a basic and profound understanding of medicine and surgery subjects and concepts is very important. And then the next most important most important attributes that medical students.
Mr. Day, we asked for one thing.
Okay.
But thank you very much. You could feel the fire and everything. Mr. Daudu, I think in one word, yes or no, do you agree with Mr. Day with me? If your answer is no, then okay, let's hear from you. If your answer is yes, we can move on to the next question, sir.
Well, I'm in agreement with Mr. Adeumi. Also like to hear the next question.
All right, then. Thank you very much for the brief and succinct answer. I think that we can continue in that regard. So my next question would be, do you think that volunteering is one of our responsibilities as medical students? And if yes, how do we volunteer?
All right, volunteering is everyone's responsibility. We should take it upon ourselves, to disseminate and those whatever information we have and help the community better. Most especially as medical students, we're at an advantage, whereby we have access to credible informations, healthcare informations. We have access to health promoting materials. We have access to research materials. We have access to latest findings and trends in medicine, public health, surgery, and different aspects of medicine. So, based on our advantage, our access to this information and our training as medical students, we can, help give back to the community, spread this information and, change the narratives. Because one of the issues we had during the COVID-19, pandemic was that there was a lot of reorientation that was taking place about the concerns of COVID-19 virus. People saying, okay, the virus is not in town. People saying it's just the propaganda of the developed country. People saying that okay, it's just a money-making scheme by the federal government and all of that because of the large chunk of COVID-19 relief funds coming into Nigeria. And we as medical students is an opportunity for us to take the bull by the horn and put this information out there. We have social media to our advantage. Instead of us just playing away in TikTok, we can make creative content and make creative. We can just try and be creative about our information dissemination. We can see the wonderful work of the likes of Aproko Doctor and how he uses his platform to disseminate health promoting information to the public in the simplest way possible, not just bringing the bogus medical terms together, but ensuring that we disseminate this information and people will actually really trust us because they understand the background that we are coming from. We are coming from a learned background. We are coming from a background of informed associates, and this will help the community better. And all of this can be done through volunteering, either in affiliation with an organization or just by personal will and choice. Thank you.
Thank you very much, sir. As I said, we would appreciate if you kindly keep it very brief. Another question for you, sir. If there was one thing you think that people in the audience today should do as a result of today's conversations, what would it be? One thing we think we should do as a result of our conversations with help from our distribution